Thank you. Yeah, imagine I report on the health issues, or maybe I bring a new story from the health space, and based on my experience there, can I, as an advocate, tell or prescribe a drug for maybe someone who needs it? Hold on, coming. Because of my exposure at that space, and then just what to prove that yes, indeed, I'm on track when it comes to health issues. Can I prescribe?
Can you prescribe what? Can you prescribe what? I didn't get that part.
The very simple.
Pardon me. Can somebody please repeat the question? It was a little blurred for me. I didn't hear all the aspects of the question.
If I report from the health space and I've gained much experience there, I know what it takes to do, or maybe it's the very thing. And after I was in my community, what can I prescribe? If someone says, okay, I'm feeling this, can I prescribe? Because I have a story.
Okay. Truthfully, you are not allowed to prescribe. In fact, you could actually be arrested and prosecuted for prescribing, since you are not a prescriber. Okay. Since you are not a prescriber, you can be actually arrested and prosecuted for prescribing. So please desist from prescribing. Okay, you are not allowed to prescribe. Maybe you can suggest, but don't prescribe. but truthfully, please, let's avoid the situation where, yes, because we have a familiarity with health concepts, we tend to want to become prescribers of certain interventions. It could actually backfire because there are different situations that require different solutions. Okay. I mean, it may not necessarily be prescribing a medicine, but even suggesting a health intervention, one needs to be very careful, because you are not a health prescriber, or you are not authorized to prescribe. And if you did, you would end up putting yourself into a lot of trouble. Thank you. Are we okay? Good. So let's look at this, the concept of how many minutes do I have so that I can round up quickly? I don't want to take too much time. So the concept of emerging infectious diseases, and these emerging infectious diseases unfortunately have the potential to cause pandemics. So an emerging infectious disease is one that has newly appeared in the population or has existed, but is rapidly increasing in incidence or geographic range. Okay, it could also be a new or emerging drug-resistant infection whose incidence in humans has increased within the last 2 decades. Okay, unfortunately, a lot of the emerging infectious diseases are viruses. Then we have bacteria. Then we have protozoans. So these are all different classes of infectious agents, and we will look at them. They usually will cause a wide range of syndromes, especially acute respiratory infections. So these days, most of the significant emerging infectious diseases have respiratory effect. That means to say they affect our respiration, our ability to breathe, and that's what is causing a lot of diseases. So the influenzas, the COVID, and all those are all part of these emerging infectious diseases that we have to be wary of. Okay. There's a classification by some as newly emerging, some are re-emerging or resurging or deliberately emerging. Okay. And they become very, very important because they have significant economic impact. Look at what COVID did to our world in 2020. Shut down the whole world. We haven't seen a lot of diseases like that in the past. And so when COVID came, it really was a big deal for us. The closest we've had is the outbreaks of influenza. How many remember the H1 and H5N1 outbreaks, influenza outbreaks, where lots of animals were killed? Currently, even in Ghana, we have avian flu outbreaks that are running. People, it happens in poultry. And so what happens then is that you have to kill large numbers of animals, of birds. It's currently ongoing in Ghana. Nobody's talking about it because we don't have full control over it. And I would recommend that some of you talk with some of the veterinarians to know what is happening in the area of avian flu, because some of those diseases, the avian flu can actually spill over. That is to say, they can be transmitted. In that sense, we use the word spillover. They can be transmitted into human beings and cause disease in human beings. So please, it is something that we need help to report on. So I'll be happy that some of us will take up investigation into the current avian flu outbreaks that are going on in Accra. I know Greater Accra has had episodes. I know Western Region has had episodes. So please, let's look out for that. Recently, we've had anthrax outbreak in Upper East Region. How many of us reported or knew about it? Anthrax is a big deal. And so if we can do something about it, we need it, and it doesn't cost much to control anthrax, for instance. You just need the vaccine that is used to make to protect the animals. It costs 1 cedi. 1 cedi per vaccine, per shot. I mean, to make it. So these things are readily, we can do something about it. If we can get government to think about it and to put money into it. So the various infectious disease agents can be classified largely into direct transmission and indirect transmission vectors. Okay, so where there's direct transmission, person to person contact, usually physical contact or droplet spread, and then indirect transmission, usually fomites. Fomites include things like the phones, door handles, contaminated food. All those can also transmit diseases. So I want us to do a little biology here. We'll look at some of the infectious agents. We'll look at some of their pictures, and then we'll discuss how they tend to be transmitted. So the viral agents now are the biggest deal. A lot of the diseases are being transmitted and that have pandemic potential are viruses. Influenza, HIV, COVID-19, hepatitis are all caused by viruses. Usually they are transmitted directly through physical contact. So either handshakes, kissing, transmission, maybe somebody sneezing. So you look at the picture of the person sneezing and dispersing all that is going on through their. Just a moment, please. Kindly give me a moment. Hi, Louis. Can I call you in a few minutes? No, I'm in a meeting. Let me call you back in a few minutes. Okay. All right. Sorry. So droplets infections, droplets can be released through coughing, sneezing, and they transmit all these viruses because the viruses tend to be aerosolized also, or they are in the aerosols that are generated from the person sneezing. Some of these viruses are also vector-borne, so they can be transmitted through infected insects like mosquitoes, like as in the Zika virus. Zika virus is far away. Recently in Ghana, we've had dengue virus, dengue outbreaks. Anybody involved in the dengue outbreak reporting? Has anybody reported anything on the dengue outbreaks? Yes, dengue is a virus. Dengue fever is caused by a virus and it's transmitted through insects, Aedes mosquito bites. Then we have the bacterial agents. So these are single-celled microorganisms, okay? They're also transmitted direct skin-to-skin contact or handshakes, body fluids, like the respiratory droplets, like sneezing, like TB, for instance, it can be transmitted, is airborne, can be transmitted by sneezing, by coughing. Okay, but TB, for instance, is not transmitted by sharing cups and spoons and clothes. Okay, so the other vector. Pardon?
Yeah,
Pardon me?
The question, please.
There's a question? Okay.
Yes.
Yes, Doc, it's a quick one. Not too serious, but it's been beating my mind. I want to know how we come by these names. Dengue, Zika, Ebola. We are being, we are teaching us a bit of biology. I want to know.
All right. So usually some of these names are assigned from where the organism is first identified, or the person who first identified the organism, or I mean, there's a naming system for naming all these organisms. You call it in technical term, we call it the taxonomy. There's a naming system for it, and usually the naming is based on the shape, the source, the structure, how long it is, how short it is, its effect. So for instance, HIV viruses are from the group we call lentivirus because they are slow acting. They take a long time to have effect. So we call them lentiviruses. And for instance, these bacteria, as you can see in the picture, they are sphere-shaped. Because they are sphere-shaped, they are like balls. We call them cocci. So anything you see with a cocci at the end, so like Acinococcus, like Bacterococcus, all those things. Anything that is cocci is a spherical bacteria. Anything that is rod-shaped is a bacilli. So TB bacilli are rod-shaped, and then anything that is spiral-shaped are spirochetes. Okay. So there's a whole naming system for all these organisms, and that's a whole educational system on its own. That is outside of what we want to do. So let's move on. So these are the bacterial agents. And then we have the fungal agents. So these are the organisms that cause like yeast, candida infections, athlete's foot, apropos, like foot rot. And they are yeast, molds. They look like mushrooms, and they also infect. They are direct spore releasing organisms. Okay. And then we have the parasites. So the parasitic organisms are various types. Okay. So malaria is caused by Plasmodium parasites. Giardia is another parasite that causes intestinal infection. It's transmitted by food. We call them fecal-oral because they are likely to be passed in the feces, and then when you eat them, when your food becomes contaminated with feces, fecal material, you can get infected. So for instance, in Accra, there's a lot of gutter water that is used to water, salads and vegetables, lettuce and growing them. So some of those things can lead to fecal-oral transmission. These days that we are doing biodigesters in our houses as the means to take care of our fecal material, the off-run, the water that runs off, which is piped into gutters, if it is not proper, if the biodigester is not working properly, if somebody has a disease in the house and the water spills over into the gutter, please, that water is an infective agent. I was last Friday, I was on a call. I was on a webinar where in the US, they are sampling wastewater, the water that runs in gutters, the water that runs in their sewer system. And they are seeing that it has become a huge repository of diseases. In fact, it was first started in during COVID, and they realized that there were huge quantities of COVID viruses in the wastewater. I'm happy to say that working with EPA, we have recently started doing some of that environmental water sampling in Ghana. And it will help us to also keep track of what is or the water that goes around in our gutters. So maybe some of you should take up stories like that so that we can report some of these issues and create all the needed awareness in our country. I'm happy to say that I was part of the team that is working to try to support EPA to do that build capacity for them to be able to sample wastewater, water running in our gutters, water running in streams, the few streams are water that is people's homes, factory wastes, and all that. We have done some work, and it's interesting, some of the things we are seeing. There's a lot of infectious agents running in our gutters, and so we need to actually take a lot of action to help address some of these issues. This is just a comparison of parasitic agents and helminthic, different types of parasitic, the protozoans and then the helminths. The helminths are more of the worms, like roundworms, schistoworm, hookworm, and all that. And then the parasites are more of the vector-borne, the mosquitoes and all that. Okay, I think. And then we have the prions. This usually are not too mad cow disease is caused by the prions. And then these are some of the long list of emerging infectious diseases that we have in our country, Ghana. There's COVID, which is still running around. COVID has not ended, please. There's still a lot of COVID running around the whole world. Ghana, we are getting, once in a while, we get reported cases of COVID. We have a lot of influenza viruses running around, different strains, different types of influenza viruses. They are always running around. Now, recently in the US, some influenza viruses from cattle crossed over into human, avian influenza viruses crossed into cattle, and even some infected human beings. So now these viruses are becoming even more adept or stronger and able to infect all different types of animals. So we need to be aware of these things, and we need to be able to report them appropriately. There's the Middle East Respiratory Syndrome, which is caused by another type of coronavirus, MERS-CoV. Then there's the Ebola virus. Ebola is a big problem. Ebola started in DRC. It is there. It keeps being spikes of Ebola keep happening, and it is the problem. Zika viruses started in Southern America, the Brazil area, and it's still ongoing. It affects the brain of unborn children, and so they are born with birth defects. Nipah viruses are bat-borne. So we've done some Nipah viruses, Marburg viruses. They are the Dankwansere, the bats running around in 37 and in the Ashanti and Kwewu Eastern region, some of them have some of these Nipah viruses. There's a program that is going on where the veterinarians, the specialized people have been trained to sample bats. So once a while, they go into the forest, then they catch these bats and they put, you know, that thing that is used to take the sample when you're doing a COVID test, the swabs, they swab all these animals to see which viruses exist in them. The bats especially, because the bats are a very, very good repository of various viruses. And if we have all these viruses running around in the bats, they can infect human beings. How do they infect human beings? You know, bats eat a lot of fruits. When they eat this fruit, they partially eat the fruit and then they drop the fruit. If, for instance, a pig or a goat eats that fruit that has been dropped, or even a human being, pigs, you know, sometimes in the bush, in the farming areas, you are going and you see a partially eaten mango, it falls on the ground, and then they take it and then they wash it, and then or sometimes they don't even wash it, and then they also eat it. That is a danger. So the person stands a high risk of being infected by the virus if the bat that ate the fruit first has viruses in them. Marburg, Lassa fever, Mpox. Mpox is a big deal right now. It's been declared as a public health outbreak of public health event of international concern in Africa. Mpox is running. We have rabies. This month, I think, next month, October, there's going to be National Rabies Campaign. Please, I'll be grateful as many of us who can be part of the National Rabies Campaign. Veterinary Services will be launching the National Rabies Campaign very soon. I'm on a WhatsApp group where we shared that information. So let me just see. Yes, we'll be launching the National Rabies Campaign very, 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 very soon. So please, I know some of us are on some of those groups, advocates for PZDs. Yes. September is the rabies. Okay, World Rabies Day is 28 September. Please, 28 September, World Rabies Day. Please help us to propagate World Rabies awareness. Okay, National Rabies Awareness. Very, very important. There was an anthrax outbreak in Upper East region. Anthrax runs amok in our country. The whole northern sector is endemic for anthrax, but we are not reporting it. So please help us to create all the needed awareness. What are some of the transmission control measures that are in place? Surveillance, early detection. We need to do continuous surveillance and early detection. Vaccination where applicable. And like I said, the vaccines for anthrax exist. We produce the vaccines for anthrax in Ghana. In Tamale, there's a town called Pont Tamale. There's a central veterinary laboratory in an agric station there. That is where we produce anthrax vaccines in Ghana. It costs us like just 1 cedi to produce an anthrax vaccine. Please, we need more support to do that. Public health interventions like quarantining, social distancing, all these things, vector control, spraying, mosquito spraying, all sorts of things. Yes. Now there are new strains of mosquitoes that are becoming stronger in transmitting malaria. And so please, we need support. We need a lot of education to go around to address all these issues. So what are some of the factors that contribute to emergence express of emerging? I use the word spillover, zoonotic spillover. Yes, when zoonosis is any infection that affects human beings and animals. So a zoonotic spillover is where the infection jumps from animals into human beings. And these days, certain diseases are jumping from human beings to animals. So during COVID time, people were seen to infect their pets with COVID virus. So cats and dogs became infected with COVID from human beings. Rapid global travel is affecting the easy transmission or dissemination of diseases. These days, you can travel in 24 hours. You can move from one corner of the world to another corner of the world. If I move from DC or New York to Accra, it would take me 10 hours. If I have a disease from DC and I land in Accra, I will interact with all the people passing through Accra, like people going to Dubai. So if I land in Accra and there are people who are also checking in to go to Dubai, I will interact with them. I would have been coming just to Accra, but because I infected them, they will carry the disease from Accra to Dubai or even to China. And you can move from Accra to Dubai in 7 hours, and then from Dubai to China in another 7 hours, and you would have infected. So the disease that came from the US can actually end up in China in one day. These days, people are traveling 15 hours from the US to China or Japan. It happens. So yes, diseases in 24 hours, a disease can move from one part of the world to the other part of the world. Urbanization is becoming a big deal. Climate change, yes, with the issue of climate change, lots and lots of diseases are really emerging. Lots and lots of diseases are really emerging. So we really need to address the issue of climate change. Like mosquitoes, certain mosquitoes are becoming more adept. Now, the places like the US where they didn't have even mosquitoes and malaria, they have reported malaria. Florida has reported local transmission of malaria. This happened earlier in the year. No, I think it was last year. It was last year where people who had never traveled out of Florida got infected with malaria. So please, the world is becoming really scary. The issue of antimicrobial resistance has become a big deal. So we all need to help address these issues. It is very important. Let me just make this keynote statement. I call them keynote statements because these are, if you don't remember anything after this lecture, at least these points, I want you to remember them. This will be our take-home points. Number one, the influence of media on public belief is so huge that sometimes people adopt a new treatment due to latest health news they learn about through the media. So the media is very powerful. Whatever we say, we must make sure that it is right, because people will adopt whatever we say without necessarily even thinking about it. The media can influence health-seeking behavior and feed hearsay that can spread as fast as the pathogen. So if we spread false information, that false information can spread like a disease and spread very fast. The media highly affects decisions even of doctors, policymakers, health professionals. Okay, considering the touchy issues of medical findings, it is incumbent that those involved to prepare accurate, complete, and reliable news. So we have a strong tool in our communication. Outbreaks of infectious disease are not only public health crisis, but also crisis of information. In disease outbreak events, when we disseminate the right information, we help address, we help in the fight against the disease outbreak. The stakes are higher now than before. Epidemics now spread not only physically, but also digitally. Now we are spreading epidemics, okay, digital epidemics, if we disseminate false information, okay? And given the potentially harmful effects of poor epidemic reporting, journalism has a responsibility to contribute to enhance public knowledge during times of pervasive fear, especially in outbreaks. When outbreaks occur, everybody's afraid. It is the media men and the media women who will help disseminate the right information and help address the fear. People are using diseases to create fear-mongering in the world. So please, we cannot afford to do that. there's a need for clear professional guidelines informed by both journalistic and healthcare ethics and educational resources for reporters to cover epidemics. So I just wanted us to, I don't just look at lessons from the past. COVID, did any one of us, I mean, of course, we must have done some COVID stories when COVID was running. What about Lassa fever outbreak in Ghana in 2022? Was any one of us involved in that? What did we say? On hindsight, do we think we did the right thing by reporting the right information? What about the anthrax outbreak in Upper East Region in 2023? Did any one of us report anything in it? Did we do right? Did we do it wrongly? Well, now that we know, how would we have done it better? What about the dengue outbreak that has just happened in Eastern Region? Have any one of us been involved in it? How would we have done it? Would we have done it better now that we know? What about the Mpox outbreak that is ongoing? So, ladies and gentlemen, this is the small thing. We will share some more information, these links in the presentation. It will be given to you. You can use to educate ourselves. This is just the beginning. I would say this is just the beginning, and the communication and the learning process will continue over and over again. So thank you very much. We are always available to help. We're always available to share information and to work with you so that at the end of the day, we all disseminate the right information to everybody. Thank you very much. And any more questions? Thank you.